Hold on.
The broadcast is now starting. All attendees are in listen-only mode.
All right, you can go and get started whenever you want.
Okay. I'm nervous. Hello, my name is Joy Oguntiman. I'm the Manager of Health Promotion and Research at North American Management. This learning module is about electronic health record technology. While this project is funded by HRSA, the content is solely the responsibility of the National Center for Health and Public Housing. At the end of this module, you will be able to distinguish between electronic health records and electronic medical records, recognize the benefits and applications of electronic health records, list the stages of meaningful use implementation, and list the steps to implement electronic health records. This module is provided by the National Center for Health and Public Housing. Our mission is to strengthen the capacity of health centers by providing training and technical assistance. Now, let's begin our training. Health Information Technology, also known as HIT, is a broad term describing the various ways to exchange health information between doctors and other groups such as insurance companies. Health IT is not just for providers, though, in health centers, it's also for patients. More and more, healthcare providers are using health IT to improve patient care and improve the overall quality of life of their patients. Here's a quick review question. The correct answer is no. Patients can use health IT to better communicate with their doctor, learn and share information about their health, and take actions that will improve their quality of life. Let's move on. Two terms frequently used are electronic medical records and electronic health records. Though sometimes used interchangeably, there is a difference between the two. We'll now further discuss the differences. Electronic medical records are a digital version of the paper charts in a doctor's office. An EMR contains the medical and treatment history of a patient in the provider's office. EMRs have many benefits to doctors, clinics, health centers, and other healthcare organizations. EMRs have many benefits over paper records. For example, they allow you to better track data over time, identify which patients are due for preventive screenings and checkups, check how patients are doing on certain parameters, such as blood pressures or vaccinations, and to monitor the overall quality of care that patients are receiving. While EMRs generally prove more beneficial than paper records, sometimes they're not. For example, patient records may sometimes have to be printed out and delivered by mail to a specialist or other members of the care team. In that regard, EMRs are not much better than a paper record. Now we'll talk about electronic health records, EHRs. EHRs do all that EMRs do, but even more. An electronic health record allows the exchange between different providers and the patient. They're real-time patient-centric records that are easily accessible. With an EHR, the information moves with the patient to the specialist, the hospital, nursing home, or anywhere across the country. Now it's time for another review question. The correct answer is E. It is electronic health records that are built to share information with other healthcare providers, such as laboratories or specialists. They contain information from all the providers involved in the patient's care. Let's move on. What are some of the benefits of EHR, electronic health records? With fully functional EHRs, all members of the care team have ready access to the latest information. This allows for better coordinated patient-centered care. EHRs give providers the access they need to the information that will help them make the best decisions about a patient's care. For example, information gathered by the primary care provider can tell the emergency department doctor about a patient's life-threatening allergy so that care can be adjusted appropriately even if the patient is unconscious. Or a patient can log on to his or her own record and see the trend of lab results over the last year. This will help to motivate the person to take medication and keep up with lifestyle changes that have improved their health over time. There are proper ways to use EHRs and EMRs in order to make sure you get the greatest impact from them. Meaningful use defines the minimum standards for correctly exchanging patient health data through EHRs and EMRs. Meaningful use uses certified electronic health record technology to improve the safety, quality, and efficiency of healthcare while also reducing health disparities. It also encourages engaging patients and family in the healthcare decision-making process. Also helps to improve care coordination, population, and public health, and maintain privacy and security of the patient health information. Let's review. The correct answer is E. EHRs can help to track data over time, easily identify which patients are due for preventive screenings or checkups, check how patients are doing on certain measures, and improve overall quality of care within the practice. Eligible professionals and hospitals have to successfully demonstrate that they are properly using EHRs to achieve meaningful use. If they do, they may qualify for an incentive payment from the Centers for Medicare and Medicaid Services, also known as CMS. There are three main objectives or stages of meaningful use. Stage 1, data capture and sharing. Stage 2, advanced clinical processes. And Stage 3, improved outcomes. This timeline shows the progression of the CMS incentive program. Since 2010, CMS has worked hard with providers across the country to increase the use of EHRs and EMRs to improve population and public health. Ultimately, the goal of HIT and EHRs and EMRs is to improve the quality of patient care. The goal is to see better clinical outcomes, improve population health outcomes, increase transparency and efficiency, empowered individuals, and a more robust research data on health systems. Let's review. Match the statement on the left to the proper stage on the right. Here are the objectives of the meaningful use stage. As you can see, there are certain sub-objectives that help to achieve each stage of meaningful use. Now we'll provide a brief overview of how to implement EHRs into your health center, clinic, or practice. We'll cover these 6 steps: assessing your practice readiness, planning your approach, selecting or upgrading to a certified EHR provider, conducting training and implementation, achieving meaningful use, and continuous quality improvement. Step 1, assess your practice readiness. To begin, answer the question, is my practice or health center ready to implement EHRs? This stage, the assessment phase, is foundational to all the other steps. You'll have to think about why you're implementing EHRs and then envision the future with the EHRs and set goals to guide your decision making. During this stage, be sure to establish a designated leadership team, a unified vision that everyone buys into, and set SMART goals: specific, measurable, attainable, relevant, and time-bound. SMART goals. Step 2, plan your approach. Create a plan that makes it clear what you'll need to start doing, stop doing, and continue doing in order to implement the EHRs. This will help to prioritize tasks and give an idea of what the new environment will look like. Here are the steps in the planning phase. For more guidance or assistance, you can reach out to us here at the National Center for Health and Public Housing or contact your local regional extension center, IT vendor, or EHR vendor. Step 3, select or upgrade a certified EHR. This step is critical and significant. Make sure you talk to other providers, your regional extension centers, and multiple vendors to make sure you choose a system that's best for you. You want to make sure that your EHR system meets the needs of your practice, your patient. Step 4, conduct training and implement an EHR system. During this step, the EHR implementation plan and schedule should be followed and executed. Also, execute the chart extraction plan and other data migration plans. This process may be the longest and maybe even the most overwhelming step in implementing your EHR. However, with proper planning, you can have a smooth transition from paper records to EMRs to EHRs. Step 5, achieve meaningful use. This is the ultimate goal of adopting and using EHR systems, is to properly use the system to improve your patient's health and use it meaningfully. Over time, having the EHR system should help your practice improve quality, safety, and efficiency. It should help to engage patients and their families in the decision-making process, improve care coordination, and improve public and population health. Step 6, continue quality improvement. This final phase is where you assess what you've learned from the training and from the everyday use of your EHR. A post-EHR implementation evaluation will help shape the practice and its evolution. There may be some kinks in implementing your EHR, which is why it's important to continually assess your use of it. Here's another review question. The correct answer is C, assess your health center readiness. The first step in EHR implementation is to conduct an assessment of your practice, its goals, needs, and financial and technical readiness. With an accurate view of your level of preparedness, your practice can design an implementation plan that meets the specific needs of your practice. Keep in mind the EHR adoption process is a journey. EHR adoption won't happen instantly. Following these steps will help to lay a solid foundation that will create a sound and profitable system. Now we'll discuss the 3 main components of meaningful use. Remember, meaningful use means providers show they're using certified EHR technology in ways that can be measured. The main components are the use of a certified EHR in a meaningful manner, use of certified EHR technology for electronic exchange of health information to improve the quality of health care, and the use of certified EHR technology to submit clinical quality measures and other measures as elected by the Secretary of Health. For stage 1, the main goal is data capture and sharing. The goal is to make sure that all the patient's health history, lab reports, and any related health information is properly captured and can be shared with providers as needed. Question. The correct answer is false. To meet certain objective measures, 80% of patients must have records in a certified EHR technology. Achieving stage 1 meaningful use means providers are able to record, store, and report clinical quality measures, CQM. Clinical quality measures relate to the quality aims for healthcare: effective, safe, efficient, patient-centered, equitable, and timely care. That's the goal. For stage 2, the goal is advanced clinical processes. Stage 2 is where you demonstrate that you can use EHR to improve the clinical quality of care that patients receive. Here is a timeline of the participation and payments by the different stages of meaningful use for Medicare-eligible professionals. You can see stage 1, stage 2, and stage 3, and the corresponding incentive payments that providers receive. Stage 2 objectives lead to increased health information exchange between providers and promote patient engagement by giving patients secure online access to their health information. There are 17 core objectives as seen here. And 6 menu objectives listed here. CMS has also published a recommended core set of clinical quality measures, CQM, for eligible professionals that focus on high-priority health conditions and best practices for care delivery. These recommended core sets focus on conditions that contribute to the morbidity, mortality of most Medicare and Medicaid beneficiaries, and also focus on areas that represent national public health priorities or disproportionately drive health care costs. If one of these sets is applicable to your patient population, CMS recommends choosing these 9 CQMs. More information can be found by clicking the link. The ultimate goal, under the revised timeline, Stage 2 will be extended through 2016, and Stage 3 will be extended into 2017. The goal of this change is twofold: to allow CMS and ONC, the Office of the National Coordinator for Health IT, to focus efforts on the successful implementation of enhanced patient engagement and health information exchange requirements in Stage 2, and to be able to use data from Stage 2 to inform policy about Stage 3. In March 2015, the announcement was released about the proposed meaningful use Stage 3 rules. The ultimate goal of Stage 3 is improved health outcomes. The 2015 edition proposed rule for Stage 3 may be viewed here. And for more information about meaningful use Stage 3 recommendations and how to achieve meaningful use, you can click here. This completes our module. Please answer the following review questions to see how much you've been able to learn as a result. Here are a few additional resources that you can use and check out to learn more about health information technology. Thank you for joining us for this learning module. If you need additional assistance or have any questions, please contact us here at the National Center for Health and Public Housing, 703-812-8822. We'd love to help you.